I am.
Okay, welcome,
Hello.
one and all. Okay, so this week's topic, let's get into it. I get phone calls to my office for symptoms. It can be also concussion, it can be memory issues, mood issues. People get concerned about dementia as they should. That's very much diet related. And they want a scan of their brain. And I translate that to is an MRI. That's what
Yeah.
I think that they want. I will ask, I'll go down that. EEG might be an option. That's kind of what I'd call a scan, but I don't know the research on if that picks up dementia. You know what I mean? I don't know. I don't use it,
Yeah.
so I'm not as well versed on it.
Yeah.
But in short, there are many things that you don't see on a scan or an MRI that is a functional problem in the brain. Yet when we go the Western medicine route, we give them medications for this imaginary thing we don't know of. And for us, we look at the function and we do things to exercise the function to get it back.
Well, that's the thing. I think that you are in a medical culture where they want some kind of a biomarker, right?
Hmm.
What's your lab value? What's your cholesterol? If your cholesterol is above 200, then.
Yeah.
If you have this finding on advanced imaging, then, that's
Hmm.
the thing, is we are looking for something to ICD-10 code, or, I mean, I started practice ICD-9 was the thing.
Hmm.
You get a diagnosis code, which means now I can link a certain set of procedure codes to it, which billing and coding people love because it's cut, print, paste, move on. Hospital admins love it because, again, they can kind of look at dollars, cents, dollars per service, et cetera, where we're not looking for dollars per service. We're looking for, what does my patient need?
Hmm.
And yes, I get the same thing. What is the MRI or the CT scan or the EEG for dementia? What is the scan for Alzheimer's? All these kind of things.
Hmm.
What is the neuroimaging of choice for concussion? Well, we know from our master's program, there is no neuroimaging finding that is specific for concussion.
Yeah.
90% of concussions have had a CT scan that is negative.
And MRI, yes.
Yeah, CT
The
or MRI.
only
Yeah.
the only imaging possibly that I would trust or think could be an option, you still need a baseline, would be an SWI for concussion because if you have any even micro bleeding, that iron gets left in the brain and they can see that on imaging.
You can
But
see that.
you do question. I don't know if the patient, I see car accident a lot. I don't know if they had that there before. If they were a contact sport athlete, I don't know, maybe.
I
Um,
well, and
should we add MRIs, some sort of baseline MRIs to our yearly, thing? We do blood
uh,
work.
probably not,
The
but at the
cash, the
same
cash
time,
price difference is not that big of a difference. A cash MRI is about 450 here in California.
same here if you're not using contrast. Yeah.
Yeah, without contrast. And the blood work that I order is about 260. And that's a
Yeah.
full blown good panel.
You can get a really good panel for yeah, not a ton of money. But that's the thing. What is your dementia biomarker for lab testing?
Hmm.
So that, but you can look and get some of these markers like an ApoA4 or things like that say you're
Which I don't,
predisposed to it.
yeah, which I don't even think is really, you still have an insulin problem even without ApoP4
Well, you
issues.
should correct it, right? Yeah, ApoE4, thank you.
Yeah.
You should correct the insulin problem, whether you've got ApoE4 or whether you've got a homocysteine clearance issue or those kind of things when it comes
Mhm.
down to it exactly. And naturally, I know your favorite thing to do with that is
Diet.
carnivore type dieting.
Yes.
Absolutely.
Yeah.
And seed oils are an issue and microplastics are an issue that
Hmm.
are very significant. I mean, what is it now? There's like 5 bottle caps worth of microplastic in most people's brains,
Hmm.
which doesn't
I believe
help.
it.
Yeah,
Driving the roads here, I believe it.
it's a high number. And the problem is you're not getting microplastics visualized on a lot of these standard brain imaging tests either.
Right.
So okay, I get that same thing. Like, can I get a scan for my
Hmm.
brain?
Hmm.
And the problem is what you'll see with your Alzheimer's, versus you've got different types of dementia. You've got frontotemporal dementia, you've got Alzheimer's. The Alzheimer's works its way from the back to the front, frontotemporal works its way from the front to the back. what you're going to look at over time is decreased hippocampal volume. It's a part of the brain where our long-term memory resides, right?
Hmm.
You've got to have a significant amount of volumetric loss on that sucker before you really get diagnosed.
Yeah, well, and for it to even be seen on MRI as well.
Yeah,
I mean, and that's still not to
it's
say
pretty
that you can't,
advanced.
even if it's shrunk, it's still not to say that you can't increase the function of that
100%.
area. Size does not equate to function. Hi, if you are enjoying this content, we would really appreciate a like or a subscribe. We're just trying to get this information out to people who might benefit. All right, back to the discussion.
Not all the time. And again, if you take somebody like Professor Carrick, the smartest man in the world, and you decrease his hippocampal volume by 20%, he's still
Yeah.
going to be almost the smartest person in the world, right?
Yep. Yeah.
You decrease Ronda Rousey, who has the manners of a goat, in my opinion.
Oh, okay. Hmm.
She's going to be probably a meaner, less mannered person. I mean,
Yeah.
she just fought this last weekend, and just watching her in the pre-fight buildup, it's like, man, she just is angry at everybody she
Well,
fights.
if that, I need that kind of a mentality to go into a fight, especially if I'm going to fight someone I respect and like.
Yeah.
That's even harder. I could imagine that. Now, it was
Then
Gina.
they
I
hug it
sent
out
you the
after the
video
fight. They're fine. That was kind of cool. Yeah.
of Gina. She sounded drunk. She lost 100 pounds. I'm like, I can't believe she was 240 because she got down to 140
Well, she went
and
through
she
a
was
lot.
drunk. And I'm like, that brain should not take a hit. Luckily, she was too slow to speak. She was too slow to kick. That's why she went down. And the whole
Well,
thing
she
was
got taken down pretty quickly by
7 seconds. Was
expert
it 7
grappler.
seconds long?
17.
17.
Yeah.
Well, at least I'm like, thank God it preserved her brain because it was not doing well, to
Well,
begin
and the
with.
thing about that, I don't know what she did to lose the weight, but you kind of look at the face on a lot of these people that are in celebrity culture.
Hmm.
Somebody just sent me one of Margot Robbie, and
Hmm.
again, I don't know that Margot Robbie's using a GLP-1
Hmm. Hmm.
or Olivia Wilde.
Yeah.
There's a lot of these people that probably are using GLP-1s that really don't need to. I mean,
Hmm.
Olivia Wilde,
She's not looking good right
I
now.
but I have my opinion on what beautiful is and
True.
these kind of things. Olivia Wilde
Healthy.
was a
How about healthy? We'll
10.
use that instead of it's not a beauty thing, what you're attracted to. It's a health standard. There are
But
metrics, whether people like it or not, that you can
yeah,
see visually.
but you see somebody who was in my opinion, like I say, an absolute 10 out of 10. Like Olivia
Hmm.
Wilde is one of the most beautiful people in the
Hmm.
world. And somebody somewhere, maybe I don't know if she did it on her own or if somebody said she needed to try a GLP-1.
Hmm.
I don't know that she has, but you see the
Hmm.
difference in the facial structures and things like that. And I don't know that Gina was doing that or not
I don't, to
as
me,
part
she
of her
looked
weight
like she
loss
may have had
routine.
like some lip injections more than
There,
anything, but
there may have
I
been
think she
that,
just
but
looked gaunt from like losing weight. I didn't think of
there,
it as
there is a
but
look. Yeah, it could have been a GLP-1 involved or not. But the thing
hmm.
about the GLP-1s, and we talked about this in
Hmm.
CNS2, which I just taught recently, in CNS1, Shad taught that, but I taught
Okay.
CNS2. We talk about spinal cord development and peripheral nerve development. And one of the things we talk about is B1 deficiency.
Hmm.
And GLP-1s promote B1 deficiency,
And B1
which
deficiency is also with insulin resistance,
and B1 deficiency is also something you see in chronic alcoholism, which she sounded like she
with
was a
goes
little
with
bit drunk,
which goes with anterior cerebellum and shrinkage of that anatomy. Yeah. Yeah.
but you have to deplete that for years for it to show
Yes.
up on imaging, which, as you can see, we talk a lot about a lot of different things.
Yeah.
Getting back on the topic, it takes a lot of years of B1 depletion for us to see imaging findings on MRI.
Yep.
People act like they've got those issues a long time before those things show up on imaging, just like our dementias,
Hmm.
just like our Parkinsonian syndromes. It takes 80 to 90% of basal ganglionic dopaminergic loss for a tremor to show up. So you're
Yes.
depleting that for 25 or 30 years before the tremor shows up. It starts in the gut, it works its way up the vagal pathways into the brain,
Hmm.
gut, nose, on into the basal ganglia, the alpha synuclein accumulation that goes with Parkinson's or
Hmm.
with Alzheimer's. It's an accumulation of a lot of different things that used to be thought of as beta amyloid disease. Now the research has shown beta amyloid alone isn't what causes Alzheimer's ultimately. There were people that were afraid of drinking soda out of aluminum cans because the aluminum was maybe what was causing Alzheimer's. And it's like maybe it's the sugar in the soda that's causing the Alzheimer's, not the
Yeah.
aluminum
Yeah.
in your cans, which maybe none of that stuff's probably great for you to be consuming over time, right?
Hmm.
Your recycled number 5 or whatever plastic bottle is a lot safer than an aluminum can, probably. So
Well,
on and
the
so
aluminum
forth.
can has a lining of plastic on the inside. So,
Which again, talking about microplastics.
yes.
And
Yeah.
I don't know that they always have. I know that's a more recent development, I think, in
Yeah.
that as well. I
Hmm.
think back in the old days it was just aluminum can, and so you might have been leaching some of that off. But if you've got an intact liver, you can deal with some of the metals for sure.
Well, your fat cells will hold on to those things too. Then we get people losing body fat and they're dumping metals and, all sorts of
You get the
stuff.
autoimmune reactions. Yeah, this is the
Yeah.
thing. Like you see where this spectrum of health is way more comprehensive than what we knew in the 80s, the 90s,
Hmm.
the 2000s. Some of the stuff we're saying now, we're going to look back on in 10 years ago. We weren't really right about that at the time, but we're starting to see people chip away at some of this stuff. But the thing is, yeah, you're not going to see this stuff on a scan until it's way, way advanced. Whereas you're going to see it like one of the tools you and I both really, really like is the sacodometer.
Hmm.
And one of the things that I'll see, and I see this consistently in those populations where dementia is a concern,
Hmm.
and it's there, where the saccadic latency creeps up well over 200 milliseconds on your
Hmm.
sacodometer.
Hmm.
Right eye's got a sacodometer function on it that it
I don't
doesn't
love that one
measure
as
them.
much.
It
Yeah.
doesn't measure them exactly the same way as the Ober.
Hmm.
Absolutely. I
Hmm.
did not like it as much either. No disclosures. I had a right eye and I actually got rid of it because I didn't find it a great fit for my clinic, and that's
Yeah.
okay.
Yeah.
The people that still use it, that love it, Cedric Noel loves his right eye, and
Hmm.
he's very good with it, and it gives him data that he really likes.
Hmm.
Totally fine with that. Just
Yeah.
for me, it doesn't matter either way. We're performing functional tests, which are looking at how does my brain perform in real time, and that's going to give me a lot more data that tells me, am I trending toward dementia? Do I have a therapeutic target? Can I do something? Because, I get this question all the time when I go to like a seminar or something like that. How do we know it's not just normal aging? Well, I mean, maybe it is associated with normal aging. I'd still like my saccadic latencies to stay below 200 until you bury me.
Hmm. Hmm. My
Just
mom's
saying.
my mom's 82 and I last tested her. She's below it. I'm better. My latencies are about in the 150s.
Yeah, same.
Yeah, and I get teenage kids not even that fast. Or
And
even people more in their prime, not that fast.
yeah, for
And I
sure.
don't really do anything to train it. I live my life and try to,
You
be
do a
healthy.
lot of things that are a healthy lifestyle that preserve
Yeah.
your brain function very well.
Hmm.
And I do train saccades and fine motor activity every day. That is one of the things that I do.
Hmm.
In my earlier life, I didn't have to, and I was able to maintain those latencies. Now it's just
Yep.
part of the deal. And again, for those of you that don't know, there are reasons that I do train my saccades and my fine motor every day. Um,
Based on injury.
2022,
Yeah.
that I kind of have to keep up on that now so that I can stay functional
Yep.
and healthy. But there's no reason not to train your brain in an appropriate fashion either, or to live a healthy lifestyle, or to do both. And one of my evolutions, and you were a heavy influence on this, is removing seed oils from my diet,
Hmm.
mainly going to a more carnivore type of lifestyle. And for those of you that follow my private Instagram, it's been a a
Yeah.
benefit to my physique as well as my
Oh,
nervous.
that's right. Yeah. Yeah.
Yeah, yeah, that I have friends, they say it's thirst traps. I'm like, no, it's progress, coach.
It's a thirst
But yeah,
trap.
with my
Let's be real.
17 likes that are mostly my gym bros, and the one guy at the gym that likes all of us muscle guys. It's
Yeah.
funny. Um,
Yeah.
you know,
Speaking of injuries, of my one patient I was sharing with you that keeps having these like syncope events started after COVID as well.
sure. Well, and
So
that's what you're looking at
we'll
is some
have
kind of
to
autonomic dysregulation,
we'll have to
probably.
look at that. Let's do a different video on that because
It'd
I'm
be,
sure
it'd
it
be a
could
good
take
one
up.
to delve into because
Yeah.
I think people will want to see, well, how, you guys have talked about some of the functional tests you do, but how do you guys actually manage a case?
Hmm.
I think it'd be
And
really,
again,
really cool.
this is something that's not going to show up on an MRI. There's
100%.
no scan. We have to, the only scan, so I eventually explain, I measure eye movements. We know those. There's six different types. They use the entire brain. We can figure out what parts of the brain are not functioning the way they're supposed to. We apply therapies to those parts of the brain or indirectly to those parts of the brain, whatever is appropriate, and rehab the function. There's no image, there's no scan.
And that's the thing is again, how do I know this is normal aging or how do I know this is not normal aging?
Mhm.
Well, I've got a finding. I'm going to apply some kind of a stimulus,
Let's
whether
see
it's
if we
one
can
of those
change
things
it.
you talked about. Do I see that latency climb toward a more healthy number?
Hmm.
If it does, I go, well, maybe this isn't just normal aging, or maybe it is
Hmm.
normal aging,
Hmm.
but I can slow that down or I can reverse some of those trends. I mean, again, what are people trying to do cosmetically all the time? I mean, you got these red light masks out there because they don't want to have all the wrinkles,
Which is
all these
funny.
kind of
I
things.
was I was talking to a guy that sells a different red light thing, but he said those red light masks are not great. They'll help with the collagen, but after about 6 months, that because red light heats up, they're damaging the muscle underneath and things start to sag because it's really the muscle underneath that you need to be healthy, right?
Yeah,
That's
working on.
why that's why lifting weights, heavy weights, people don't. I'm like, I go to women in the gym in particular. I'm like, you need to lift heavier weight. Th-
100%.
This is not doing anything for you. But
Just
I
standing there.
only if I judge that I think that they could take that kind of a comment, and I deliver it, like, lady, you got to do a little more than that.
Yeah,
So that
massively.
stimulus helps stimulate the collagen and the muscles and everything. Just straining and trying to lift the weight, it shouldn't be like, it should be hard.
If you can have a normal conversation while you're lifting the weight, it's not heavy enough.
Correct. Yeah.
That's
My
the best rule.
I work out with my sister a lot. We time each other, so we do things based under time, under tension and whatnot. And then I'll have other people like, if you want to come see what we do, and I have a patient right now meeting me at the gym, and she'll be in the middle of telling me a story, and I'm like, I just have to tune it out because I'm like, I'm not hearing what you're saying right now.
Yeah. Well, yeah, because you actually, and that's one of the things we talk about too, is mental set and the way the nervous system works go together very well.
Hmm.
Yeah, I had a guy, I train by myself now, and I mean there's and the office that I have, I've got a facility in my office. The thought process long term is to get a physical therapist in here. So if anybody knows a
Yeah.
physical therapist with a
Okay.
following, I've got a place they can rent.
Omaha, Nebraska. Who wants to
Yeah,
live
suburban
there?
Omaha. It's a beautiful, it's a gym that you would never want for anything.
Yeah.
Um, but I work out by myself, and I used to have a guy that I trained with, and that's the thing. It's like, no, I don't want to talk for 10 minutes about the Michigan game between sets. It's like I'm trying to get
Hmm.
15, 20, 25 sets of stuff done in an
Yeah.
hour.
Yeah.
And he's like, what's your hurry? I'm like, I don't want to be here for 4 hours on a
Yeah.
Sunday, man.
Yeah. I would like to get things done and go be with my family and.
This guy will, will open the garage doors at the gym when it's hot out because he wants to sweat when he works out. And it's like, just work
Mhm.
out harder.
Yeah.
You'll sweat.
Yeah. The only reason I would open is because you're getting sunlight. I want the benefits of
Yeah,
that
sure.
light, not because I need to sweat so much, but yeah. So scanning, what other scan? So EEG, I don't do in my office, but I do like
Well,
that EEG.
there's EEG and then there's QEEG.
QEEG.
Two
QEEG is
two
really what I'm
different
talking
beats.
about.
Yeah. So yeah, I don't do that in my office either, but I really like it. So you're looking at more again, your EEG, your standard, you go to the hospital, we're
Hmm.
doing an examination on the cerebral cortex to see if we can evoke or to see if we have the presence of
See a
seizure activity,
seizure.
right?
Yes. Yeah.
That's what we're looking for with that. With QEEG, it's very much like the sacudometer in that we're looking at do different parts of brain communicate with other parts of brain like they should,
And the
or are they
timing
able
factor.
to, yeah, are they
Yeah.
able to lock in and focus? So you're looking at like phase lock and phase shift potentials at different parts
Hmm.
of the brain.
Yep.
And an ideal brain should be flexible enough to do both, whether it's focused on the frontal lobe, the temporal lobe, the occipital lobe, the parietal lobe, whatever they're looking at. And there's things you see with autism spectrum disorder where the phase lock can't be broken, or there's things in dementia where they can't phase lock or things like that. If you correlate those types of things with a sacudometer and a posturographic exam, for example,
Hmm.
you get a
Hmm.
really, really nice comprehensive picture of what a brain's really doing. Because yeah, I know they do that at Neurologic Wellness. They do QEEG along with
Yep.
some of the
I
tests that
know
we do.
Kelsey. I've seen Kelsey do
Yeah,
it.
yeah,
Yeah.
yeah, yeah, yeah. Dr. Trasser's wife will do it for
hmm
sure.
hmm
And I think Drzwicki's wife does it too.
Oh, does she?
I think yeah, I think she
Okay.
does it as well.
Okay.
'Cause, yeah, I see her. Christy will, well, Dr. Drzwicki as well. Will
hmm
post about yeah, both of them. Yeah, Dr.
And it's Dr.
Drzwicki.
Kelsey Traster. I don't know if she changed her name.
Yeah,
Probably did. Anyway.
I think she did. Yeah, I think she did. Yeah, but and I mean, I called her the gold mine during the TBI boards because everything she wrote was just perfect and
Yeah.
beautiful,
Yeah.
very, very succinct. So they're both extremely intelligent individuals that
hmm
do this work. I've got a couple neurofeedback specialists in my town that I refer back and forth with that
hmm
do it because I don't do it myself.
Yeah.
And it's very handy. So that is a more functional test than a scan per se,
Yeah.
I would say, because there's a protocol and it takes time and they're getting data and
Because again,
interpreting.
it's a functional test. It's not a static image.
You can get into some other things like your bold MRI, which is a blood oxygen level dependent MRI.
Okay.
That'll kind of tell you a little more what the brain is doing in using fuel. So they'll do some provocative things during the imaging, and that
hmm
might tell you a little bit more about it as far as
Well, Aiming
functional tests.
Clinic, for example, and
Yeah,
I heard this from someone, I'm not sure who. So when you're looking at those scans, it's measuring where a lot of the blood sugar is going.
yeah.
How did they say it? It's not showing where it's not going, or maybe you're more efficient in this other
Yeah.
area. I
Just
can't
like a
remember
PET
how.
scan, yeah. PET scans, SPECT scans, all those kind of things. They are a yeah, you're using like a radioactive glucose or some kind of isomer that you can trace and track and see what happens.
It's not
Blood oxygen
necessarily
level dependent
functional
MRI.
though.
It technically is considered a functional test, but yeah, at the same time, if my left frontal lobe is super efficient,
hmm
say Ben Affleck in The Accountant is always the thing I go to where
mm
he doesn't have to work on doing math equations at all.
hmm
You give a normal person a math equation, that part of the brain will light up because it's really having to think. You get
Yeah.
somebody who can do math without having to think, you're not going to see a whole lot of fuel utilization needed for that. So again, if I'm super plastic in that area,
Yes.
it's not going to draw a lot, and it may be diagnosed as an underactive area during an activity.
Or a
Well,
hyperactive other area that has to
yeah,
work hard to just do, whatever it is. Yeah, that's what it
you're,
was.
you're comparing an Olympic athlete
hmm
who's really good at brushing their teeth to somebody who can't brush their teeth. It's
hmm
going to look different for
Yeah.
sure.
Yeah. So, in short, there is no magical scan for dementia that I know of, that either of us know of. It's more of a function. When people are complaining about memory issues, mood changes, quick to anger, lack of ability to read sarcasm, that's one of the first ones. Um, those are the biggest things. And the first question I ask is what their diet's like. And usually their diet backs up a very glucose, insulin driven
Yeah.
diet and getting that to come down so your body gets sensitive to those receptors again, or getting some sort of ketone in there to help rescue those neurons. And that could be diagnostic as well. If I have somebody take some ketones under guided, I make sure they're not full-blown diabetic and whatnot, but have them take ketones, whether it be as an acid or as a salt. Do they respond well to it? I'm thinking a little bit of a diagnostic
It's very
window there.
diagnostic,
hmm
absolutely. You know, I've got insulin sensitivity issues. I've got some definite inflammation that's going to go with that in the brain and probably in the gut as well.
hmm The gut
Generally,
loves
those go together.
ketones. They're
I've probably
short.
got glymphatic issues.
Yep, the whole thing.
Yeah, so you got to clear the gutters out too.
Okay.
Which yeah,
All right.
we've talked about that already before as well.
Yes. Yeah. Well, that's all I got on this particular topic.
I think that's the take home is yeah, there is not a scan, but definitely seek out somebody who obviously we're always going to say seek out somebody who's character trained in your area.
Yeah, because
But with the problem,
literally no other profession that looks at the nervous system like we do in a functional manner.
100%.
I
You're going to
don't
see
want to
it with
do what
invasive
MDs
therapy.
do
Yeah,
in the nervous system. I don't want to do
yeah.
what they do. I'm going to let them stay in their lane. I will refer to them in their lane when necessary, for sure. I feel like I wish they could recognize and do the same and come out and not
And
throw a pill.
that's exactly what it is. Or if you again, if you're a medical doctor and we happen to have gotten your attention on this topic
hmm
and you don't know what to do, other than prescribe the medications for somebody. You
Yeah.
should take anybody who you're diagnosing with some kind of dementia, frontotemporal, Alzheimer's, or other age-related aspects of
Mhm.
decline. You should have them doing some kind of exercise. You should have them seeing a character trained person in your area. And honestly, you could also refer them to other things to work that cognitive brain. Their speech language pathologists
Mhm.
in some respects do a great job with it. But again, find somebody who's character trained in your area. We are more than receptive to helping you with your patients.
Yes.
We will report back to you with things that you probably didn't even know that we looked for. You'll
Mhm.
be you'll be impressed. You'll be
The
impressed with
nerdiest,
the character
nerdiest
trained
group of
people.
doctors you'll ever meet, in my opinion, truly.
Absolutely. And
That
and
act,
and
that
that's the thing.
care, and it's almost a competition to how nerdy and how you can figure out these little things. It's fun. So,
That's what it is. You get all of us that are faculty that are like, what can I write a class on next that nobody's looking at?
yep.
We want to just continue to expand the things we can do for these patients who need, again, lymphatic clearances, blood sugar controls at a
hmm
minimum, and physical exercise.
Yes.
Again, in a diligent, well thought out manner.
Yeah, because people don't realize I'm going to start everyone at walking if they're not working out because
Yeah,
if you go intense and you're sore, you're inflamed, and that's going to make you insulin resistant from the inflammation.
100%.
So I personally would rather start with diet and walking after meals at the very least to just get that glucose used so that the insulin doesn't have to come out and create an issue.
So they don't crave the sweet stuff right after they eat.
That, I mean, yeah, because that's, insulin resistance, right? That insulin
Yeah,
goes up, locks down the fat, and gets all the blood sugar, especially if that spike goes straight up,
yeah,
sucks that blood sugar right out of the bloodstream. Now the cells are like, we still need energy though. So
yeah.
then you're going to now start breaking down your muscle for gluconeogenesis if you're like white knuckling it, or you're going to go eat crap. Or I usually encourage people to eat fat
Yeah.
because your body can't get to the fat that's on its body because insulin is locking that down for
Yeah.
many hours after you've already spiked it. So,
Yeah.
anyway,
And,
okay.
and, and muscles are
Okay.
less like fatty acids, so makes sense.
All right.
Preserve
Well,
the muscle.
let's end this topic here and we'll follow
Okay.
up with something else.
All right.
Okay.